They're strong.
So this
Strong.
is, out of all the things that we have posted online, this is the most controversial thing we've received the most
Whoops, too
backlash
strong.
for, I think. And it's not speech therapy specifically, but it is the talk tools that are used during
There
speech
it is.
therapy.
Longer. How many should we do? We're definitely trying beginning and end for her. Because
Candy, veggie
don't we
straw,
all want to know when
veggie
something's
straw.
going to end?
Right.
So letting her know we're going to do it this many more times, or we're going to try this many.
This is a voiceover, yes, but you're going to hear my family in the background because we're not professional voiceover people. We're just a family that does therapy with our kid. So this is speech and language pathology, very typical therapy received by people all over the world. Our daughter is nonverbal; she has never spoken a word, but the part of it that is controversial is the talk tools portion. These talk tools are used to teach and train how to shape muscles in the mouth, how to control air, things like that. And the reason why it's controversial is because of a lack of evidence-based, essentially proof, testing to show this works or this doesn't work. And I think the problem there is because it's hard to prove. It's hard to have like a group of people that you're testing to see if this therapy works or whether it doesn't work, because every person and every child is so very different, and the outcome is going to be so very different with these therapies. And it's also a newer thing, and people tend to scoff at newer ideas, and they stick to the tried and true things that they've done in the past. And when new things come up, I don't know if it's a fear thing. I don't know if it's just being stuck in old ways or whatever. But people tend to have a hard time with new ideas. So, and it is relatively new comparatively speaking to other therapies and practices that are done in this field.
And then you may have a little bit of pirate booty. Okay? First H. Open. Open.
She's also learning. She's learning to manipulate air movement to make sounds and blow bubbles and all of those things, and maybe they never will lead to her talking, but she's also learning skills at the same time, and I don't see where there's harm in that. Now, our primary focus during speech therapy is not the talk tools. The primary focus is utilizing an AAC device. That's going to be our number one thing that we focus on, because that's what's going to be most effective and most beneficial for our daughter, rather than vocal verbal communication. So our speech therapist works hand in hand with the other therapists to fine tune her communication device, as well as us as parents, because we do get to see her at home utilizing her communication device and the different ways that she communicates. As far as talk tools, I want to look at it as from a logical perspective, and to me it makes sense in my brain, and I don't see the harm in trying something new or different to try to get results that are going to benefit our daughter's life, that are going to make her more independent and able to communicate more on her own, even without assistive technology. And if there's no harm in it, then why not try it?
See you next week.
Because sometimes
Yeah.
we're chalking it up there and just seeing what, essentially throwing things at the wall and seeing what sticks. Because there's so much we don't know about autism. There's so much we don't know about nonverbal autism specifically. So it's certainly something worth trying.
You were kind of rotten, huh? You were showing off? I mean, showing up, not really showing off. It's okay. We've seen. It's her iPad
Beethoven music.
playing some soothing music. Look, in protest, both of the tablets are on the floor right now. After all
You don't want to
that,
talk to any of us now?
no, it's like I'm done talking. I'm glad that you were happy to see her though, but can you maybe do some work next week, a little more than what you did?
So at first, she walked up the stairs. She was all excited because somebody was at the door. She walked up the stairs, saw who it was, walked back down the stairs. Jill's like, wow, I've never had that happen from Abigail before. I was like, Abby, don't be rude to the guest.
She would actually wear a thing around her neck in the classroom that said no Abby time, like not Abby time. So when she had push it in the classroom, she would try to, interact with her while she's doing therapy with other students. So.
Do you want your music back on? We can do that. We just had to turn it off so you could focus.
So that form of speech and language pathology can be considered controversial because of the lack of ability to to test it, and that's why that even exists as like a controversial thing. There's controversy in that field, but it has been beneficial, and logically, like, it makes sense to us. You know, it may or may not make sense to you. I don't know. I know there's a lot of speech therapists that watch our content. It makes sense to me that the muscles have to move in a certain way and the mouth has to move in a certain way, as well as the lungs and how you manipulate air and all those things in order to make sounds, which, you know, eventually turn into words. But a lot of our focus really is on communication devices, on an AAC device, because that's where Abigail's going to be the most successful. We feel in the future there's more of a guarantee. Like, there's not like a giving up hope thing or anything like that. It's just more of a guarantee that she is going to be able to communicate effectively her wants and needs and create that independence through an AAC device versus verbal vocal communication.
I think there's a considerable amount of merit in the experienced speech and language pathologists that work in the field and see the anecdotal results from their clients. And I think that's definitely something that needs to be considered, not just studies and tests.